people who could not make this meeting will be able to benefit from any of the presentation and or question and answer back and forth. And we'd like to make that available as broadly as we can, and so that we're requesting permission to record for that reason. So I'm going to ask Sasha to turn on the recording. As Zachary said, my name is Bob Gold. I'm a faculty member in the School of Public Health. I was the founding dean of the School of Public Health and currently chair of one of its departments. In today's session, we're really looking to accomplish just a few things. One is we want to begin by describing the impetus for this project, and in this project, we had a number of different people playing different roles. And we'd like to have a number of people who served on our advisory board, both faculty, students, and alumni, share some statements about their sensibilities that came to the fore during this project. We'll then turn to what methods were used in this project to try and make a course that is required in the School of Public Health more accessible to the greatest number of students. And then we'll review the findings, and at that point, we'll leave it open for questions and answers. If you do have any questions that you'd like to pose, please feel free to share those in the chat with Sue Johnston, who is going to be managing the question and answers at the later portion of this presentation. So now what we'd like to do is request that each of you click on the link that Sasha just put in the chat, because we would like to find out who is in this meeting. And Sandy, I'm going to take over the screen sharing here. I'm going to give this another 10 seconds for those of you who have not yet responded. I find this a bit surprising to me, but I'm very thankful that we have so many different kinds of people involved in this session. What I'd like you to do is, if you are in the other group, if you would just share in the chat to Sue or to Sasha how you classify yourself as other than one of these other categories. Now, what we'd like to do is actually ask you to complete one more poll, and this poll is, when you hear the phrase accessibility in higher education, what's the first word or phrase that comes to you? And if it's you can submit up to 3 words or phrases. And if you're entering a phrase, we just ask that you put a dash between the word, every word in the phrase. I'm going to give this another 15 seconds or so. If anyone would like to add any other things here. For those of you unfamiliar with word clouds, the more frequently a word is entered by different people, the larger that word will appear on the screen. And as I look at this word cloud, I'm struck by the most frequent responses being inclusive and equity. And it looks like inclusion and accommodations are there as well. But one of the things that strikes me is that when some of you hear the word or phrase accessibility in higher education, I see not very accessible as one of the responses. It's important, not always available as well. It's important for us to understand what people are thinking when they think of accessibility, in part because we're trying to find out how we can respond in the best ways to different audiences. And we're doing this not only to collect a little bit of information about you who are participating in this session, but also trying to illustrate an activity that you might use to try and learn more about groups that you work with in real time. Sandy, I'm going to stop sharing my screen now. We will share this word cloud with everyone as a file in just a few moments. Sandy, will you go back to the slides, please? Thank you all very much for responding to those two polls. Next slide, please, Sandy. All right. I want to talk just for a moment or two about the impetus for this project. I'm Director of Educational Innovation for the School of Public Health, and I've been concerned about accessibility personally for a very long time. Most people in higher education seem to think that the most important issue about accessibility is closed captioning, which gets a lot of attention, but as most of you know, there is so much more to know and that is needed to be done. Now, when our provost here at the University of Maryland announced the availability of teaching innovation grants in the late spring this year, I saw that as an opportunity to do a couple of things. One was to fully examine what it would take to make an online blended or hybrid course fully accessible in the broadest possible context and meeting the needs of the most people that we could, and to build a way for us in the School of Public Health to find a way to educate all of those in training in professional programs. Since they deal with diverse communities, we felt the need to introduce the notion of accessibility to them as students in our programs, and to introduce how and what they might learn about making their professional practice more accessible. And we saw this really as that two-way thing: make the courses more accessible, but also train our students to understand accessibility and its needs. I'd like now to ask Rosanne Rushing, a faculty member and director of the Public Health Program at Gallaudet University, to add her sensibilities about the impetus for this project as well.
Good morning. Thank you for having me. As Dr. Gold said, my name is Rosanne Rushing, and I am the Public Health Program Director and Associate Professor of Public Health at Gallaudet University. And I'm really excited to be part of this project because I have really been focusing on equity and inclusion in teaching courses at Gallaudet and working in the field. And one of the things that I really appreciated about this study was that one of the main and significant focus was on making this an inclusive process. So not only were we coming up with how we could teach and learn in an inclusive way, but how this whole study could be inclusive. And so we made that possible through an inclusive process and creating and adapting the course tools with the information that we received from students and the advisory board. And as Bob said, this is also an excellent way to train future public health leaders, whether they're teaching or working with different communities, that accessibility is a key priority. And for me personally, this has been enlightening and helpful for me to really have kind of understood students better and understood where their needs are and how we as professors can meet them where their needs are and really work together to make their learning environment really successful and allow all students of all abilities to flourish. So thank you.
Thank you, Roseanne. We're going to turn now to some statements from our advisory board members, and I'd like to turn back to Zachary for the first one, please.
Yes, hello again. Again, my name is Zachary Tumlin. I am an archivist, an educator, and a disability self-advocate. And my connection to the University of Maryland is that I finished grad school there in May 2019. And so serving on this advisory board interested me because of what's important for me to participate as a disabled person, and that research on disabled people include disabled people, not just as participants, but in all aspects, from designing what the research is going to be about and the methods and how the results are disseminated.
Thank you, Zachary. Sarah, can we turn to you, please?
Hi, everyone. My name is Sarah Hatfield. I use she, her pronouns, and I'm a junior at the University of Maryland, pursuing degrees in behavioral and community health and family science. I really wanted to join this study to serve as an advocate for individuals with invisible disabilities. I also had the pleasure of taking Health 364, the course that was designed for accessibility with Dr. Saperstein in the spring. So I really had the firsthand experience of having to transition mid-semester to virtual learning in the class as a student with a disability. And I also really wanted to learn from the perspectives of other students in the disabled community as to my own role in being able to increase the accessibility of online materials.
Thank you, Sarah. Let me turn now to Becca.
Hi, my name is Becca Pittard. I'm from Gallaudet University. I'm a current senior, and I major in public health with a minor in psychology. The reason why I joined the advisory board, because it's very important for hard of hearing students and deaf students to really get a concept of online learning, because right now everything's online. It's hard for like deaf culture and the hard of hearing culture. It's hard. You don't have someone face to face, but face to face, and it's really important for this advisory board members to have all this different disability to come in together to help improve it for not just for like one university, for like Maryland, but also for like Gallaudet University.
Thank you, Becca. I turn now to Adith.
Hello, everyone. My name is Adith Thumalapalli. I use he, him pronouns, and I'm a recent graduate of the University of Maryland with a degree in mechanical engineering. And I did a lot of advocacy work as a student on campus, and I continue to do work as an alumni now. And my motivation for joining the advisory board was, as an individual with a physical disability, I wanted to learn a bit more about the perspective of those with invisible disabilities and how they attend courses and the issues that are important to them. As an advocate for disability rights, I'm always interested in learning from the perspectives of others. And working as part of this advisory board, I was able to speak with many other people who are interested in the concept of improving accessibility in terms of course material, as well as making it easier for those who are interested in making their courses accessible, give them the educational foundation they need in order to do so. So my motivation for joining the advisory committee was to help faculty members and staff members in the future make their own courses more accessible.
Much appreciated, Adith, Becca, Sarah, Zachary. What I want to do now is turn to Sasha Sainon Ahmad to review the methods that we used.
Thanks, Dr. Gold. This is Sasha. I'm a doctoral student at the University of Maryland, and I helped coordinate this project over the summer, and I'll quickly describe our methods to you. There were two main parts to our research. The first was we assembled an advisory board to provide guidance on accessibility recommendations and universal design for learning principles in the context of online learning. The advisory board members provided input on various tasks that we assigned to them over the summer. We assigned these tasks via email, and also we had a focus group discussion towards the end. The second approach was we conducted interviews and usability tests with students in order to understand their experience as college students with disabilities and with online learning through Canvas. We wanted to know their Canvas and online learning preferences and whether a Canvas site that we had designed would be easy or hard for them to navigate. We, next slide, please. Thank you. We recruited people for both the advisory board and for, as participants for the research by sending emails through university listservs, through word of mouth, through recommendations for people who are already on board. And we recruited both from the University of Maryland and Gallaudet University. In total, we had 9 advisory board members consisting of a mix of faculty, staff, and students from a variety of backgrounds, including we had a lecturer, we had an instructional designer, someone who was a policy and communications manager, and so forth. And for the students who participated in our research, there were 8 in total. They also were from a mix of backgrounds, so we had graduate and undergraduate students. We had majors in public health, physiology, and neurobiology, aerospace engineering, survey methodology, and a few more. For the interviews and usability tests, we used structured interview guides. All of our data collection, of course, happened virtually. Because of COVID. Most of it happened over Zoom, some over email, depending on participants' preferences. And this project, all of the research activities were mostly conducted between July and August of this summer. And now I'll hand it over to Dr. Saperstein, who will share what we found.
Hi, everybody. I'm Sandy Saperstein, and it's really been an honor and a gift to be part of this project, and I'm excited to share the results with you. I am going to be sharing just some very high-level results and try to make sure that we leave time for questions. In our first set of interviews, we asked students a lot about their experiences being a student with disabilities, and we found that most of our students were receiving accommodations, and for most of them, primarily, it was extended time for testing. But some of the other accommodations that our students were receiving were having extended time for assignments, preferential seating, having a note taker, using a calculator, and having food and water during exams. We asked students how they had conversations with their professors about their need for accommodations, and they were really split. Some chose to communicate with their faculty in face-to-face conversations. Others preferred to do it by email. And the students who preferred email tended to be students who had challenges with social interaction, and some who said they wanted to have documentation of the conversation. Through our conversations, it became clear that for some of the students, they really talked about their reluctance to talk about their accommodations because of the stigma of disability. They said they didn't want to be seen as taking the easy way out. Most of them who had conversations with their professors felt that faculty were supportive, but they really talked about how personality mattered, that some professors were considered easily approachable and others were not. And in the cases where they were not, the students chose not to talk about their need for accommodations. They found it harder to talk about accommodations in large classes. If you can imagine at the end of a large class when many people are lined up to talk to a professor, they didn't want to have a discussion about their accommodations in that kind of a setting. And a few students reported negative experiences. We had one student who described having a chronic condition where she had frequent exacerbations that made it difficult for her to attend classes. And she had one professor who wanted a note from the health center each time she was not going to be able to attend class. She lived off campus and she felt like if she could get to the health center, well, then she could get to class. She said, "I wasn't asking for an A, I was asking for a chance." We asked students about their experiences with online learning, and some positives were highlighted. The ability to work at your own pace, to be able to pause and rewind a video if you missed something. And for students whose disability impacted attendance, online classes made that better for them. But students did highlight some negative experiences with online learning. They talked about that online learning really requires a lot of self-motivation, that sometimes it was harder to focus. They noted that in online classes, professors can't readily see confusion, which you can see in a face-to-face class, if you're looking at students' faces. They talked about the time burden if they needed to rewatch a video to try to find some information when a transcript wasn't also provided. Students with social disabilities talked about feeling like there was much more pressure for small talk, to engage in small talk at the start of a synchronous session that felt very different than if you were in a face-to-face class. Some talked about professors wanting the video on and then having negative experiences where the professor might comment on a student being there in pajamas, or that students weren't seen actively taking notes. And they also felt that it was harder to discuss their accommodations in an online setting. We asked students to share their recommendations for professors who were teaching online for the first time. And they said, just assume that there are disabled students in your class and make accommodations, even if you don't have a specific accommodation letter from a student. And they also really wanted help with accountability, help knowing what they needed to do at particular points in time, what the requirements were, because this was often very difficult in online classes. And some suggested having increased office hours so students could come with questions more readily. We asked about their experiences with Canvas. And before I share what their experiences were, I would like to show you a picture. This is a picture from an Escape the Room game. I don't know if any of you have ever played an Escape the Room game before, but your task in these games is to figure out where to find the key so that you can get out of this room. So in a minute, we're going to do a poll everywhere question. And I'm going to ask you, where is it that you would first look for the key? Would you look in the plants? Would you look under the couch cushions? Would you look in the end table drawer or in the bird cage? So I'm going to stop sharing so that we can pull up the poll everywhere. And Sasha will drop the link in the chat. And then Bob will show us the results. Oh, Bob, you're muted. Okay, so I'm going to guess that most of our poll results are in, and we can see that people are talking about looking in a variety of places for where they would look for that key. I'm going to ask Bob to stop sharing, and I'm going to go back to sharing. So you might be wondering why I asked you to do this exercise. What came out in the interviews was that many students felt that their online experiences with Canvas was something of a scavenger hunt, that for every class they had to figure out, where did the professor hide the assignments? Where did the professor hide the videos? What did they have to do at the end of the day? So you can imagine this was a pretty frustrating experience for the students. Other experiences with Canvas and their online classes covered a variety of areas, when turning in assignments that aren't graded in a timely way, lack of ability to customize calendars and reminders on Canvas, not knowing if you had an accommodation for having increased time for quizzes and tests, whether you actually got that increased time. There were also some, for certain exams, some time-demanding steps that had to be taken into account. So imagine taking a math class where you had to show your work. And for that Canvas exam, you had to print out the exam, take the exam, photograph the exam, and then upload that in the exam time. So that created more stress for students. And then they also noted that there's a lack of ability to ask questions or clarifications when you're taking exams online. They did highlight some positive experiences with Canvas, and most highly the use of, they really preferred when materials were organized in a module structure. We'll talk a lot more about this. And then also they appreciated announcements from their professors that sometimes just contain general support, but also reminders and updates. We asked students as part of the interviews to review what the Spring 2020 homepage and one of the module pages looked like, as well as the prototype that we had for fall. We asked them as they reviewed each page. For the home pages, they rated how welcoming the page felt using a scale from 1 to 10, where 1 was not welcoming at all, to 10 being very welcoming. And we asked them to rate how organized the module pages were, using a similar scale, 1 being not organized at all, to 10 being very organized. I know that some of these screen captures are not the easiest to read, but it will give you just a high-level sense of what was going on. So in Spring 2020, the homepage for the course was a typical Canvas layout that had recent announcements at the top and modules underneath. And students, again, very much liked having the modules readily accessible. We also asked them about the left navigation, which they didn't always realize that professors could customize. And I think maybe many professors don't realize that you can customize it, because one of the biggest complaints was having links on the left that didn't lead anywhere, especially the syllabus. So then we showed them what one of the modules looked like when we went online. So you can see that this module has about 15 items in it. They talked about this being overwhelming. It was cluttered. There wasn't enough detail about what the activities were. And so that they expressed that this would probably be a very frustrating experience. Over the summer, our team participated in the Teaching and Learning Center's design sprint. So we built our fall prototype using a a layout that we received from them. So the immediate reactions to this page were that it felt friendly and relaxed. They really responded positively to a page that had some pictures and graphics and a movie on it. Some commented that they would feel comfortable emailing this professor. But as you can see, it's a very long page, and they talked about that there was too much scrolling on it, and that the Start Here button was too low and it wasn't easy to find. And I will say, in the TLTC template, the Start Here button was higher, and I moved it down because I felt like students might not see what was below the button. So we'll talk a little bit more about how we compromised on this in our final design. This was our prototype module page, and students really responded well to this. They felt like it was much clearer. They liked the headings that really separated the content. They commented, they noted that the videos had lengths on them so that they would be able to budget their time better. However, they still felt that some of the category names that we chose were not clear. For example, at the bottom, the last category says module wrap up, and that was not where they were expecting to find a quiz or an assignment. And they also wanted assignments to have due dates on them. So when we looked at their ratings from the spring to the fall, they definitely felt that the homepage was more welcoming, the prototype was more welcoming, and the prototype for the module page was more organized. We took these findings, and we made some changes, and then we conducted usability testing. In usability testing, students were given control. They were able to access the website while we watched. We gave them tasks to do. Could they find certain kinds of information on the website? And we found that most were able, using the prototype website, to successfully navigate through the course. Some recommendations were reiterated here, and I'll just say them again, that really important to have informative titles for the headings, that you want to reduce unnecessary or repetitive text whenever possible. Be consistent in your use of font sizes, color, and formatting, especially when you're highlighting the action items that you want students to take in the modules. And students were really looking for supports to help with self-organization. This came up in the interviews, and what we added in the prototype was just a simple checklist that I'll show you in a minute that they really appreciated. So what I would like to do next is I am going to walk you through what the course looks like now. Oops. So hopefully you can all see this. This is the student view of the course. And we did customize the images so that they relate to the course content. We moved up the links for the syllabus and the modules, so once they got to the home content, they could get to it easier. There's a welcome video, and you can see there's a lot less scrolling required than what we had in the prototype. There is a Start Here section, and you can see that we made this font bigger so that it would stand out. As students work their way through the Start Here section, the idea is that they are getting an overview of what they're going to be doing in class. So they learn a little bit about me. I did learn from the feedback that my infographic did not necessarily have enough contrast, so I will redo that at some point. But there is a text version here for students with visual difficulties. There's a section where we want to learn about the students. There's a link in here to a survey that some of them missed, so we made the link more prominent. And we have information about accessibility. There's information about the course outcomes, and I will let you know that the students did feel that we could leave this out, that this was something that was more important to faculty than students. But as I've shared with other people, as a parent whose students were introduced to broccoli often, I, as a professor, felt the need to keep the outcomes in. We also had a course pattern, so there was a schedule for the week, and in the TLTC template, this was a little lower down, but students wanted this more prominent. So we moved this up higher, and it basically gives them an idea of what they can expect each week. When are the modules going to be released? When are office hours? When's the synchronous session? When are assignments due? And then from here, they see the syllabus. And truthfully, students told us in the beginning that once they looked at the homepage, most of them would have clicked directly to the syllabus and not necessarily worked through the Start Here pages. I left the syllabus here because I figured we couldn't have too many opportunities for students to find that syllabus. But I think this is, if we wanted to reduce content, this is something that we could take out if we needed to. Once they go through the Getting Started section, then the first module unlocks. And the module pages now look something like this. So each week there's a customized image. There's an introduction so that they know what they're going to see in the module. There's a checklist, and I'll show you that in a second, which is very simple to keep themselves organized. There's objectives. There's a learning activities section where all the activities are numbered and they start with an action verb. The videos are captioned and there are transcripts available. They also have the length of time, which students told us was very important to help them budget their experience. There are the activities that they need to do with due dates for assignments, and then reminders about the office hours and synchronous sessions. Let me show you, what the checklist looks like. And you can see that basically, oops, too big. I took the learning activities that are outlined in the class, and it's just a very simple checklist that they can print out as they need to. All right, so let me bring us back to the slides. So that's a walkthrough of Canvas. I want to just share a couple of last things. We met with our advisory board, as Sasha said, primarily through email and through a focus group. And we gathered many recommendations for how to create accessible content. And our advisory board worked with us to help rank and prioritize where we should be putting our focus. And so one of the main themes was ensuring that we had accessible content, our captions, our transcripts, putting out materials in multiple formats. One of our advisory board members said, sometimes it's hard for something to be 100% accessible to all people at all times, but the more you can provide options for people, they can choose what works best for them. Some of us might feel like this can be a challenge to create accessibility in our classes. And I will tell you that it does take a little bit of time and a little bit of effort in the beginning. But one advisory board member pointed out that we do need to develop good habits in this area, that it can become good standard practice. And this advisory board member said, for me, it's like a form of hygiene doing these things. At first, it can seem like more work to do some of this stuff, but over time, it becomes things that you are just in the habit of. And those words echo a lot in my head throughout this semester. And I will say that these practices are becoming like hygiene to me. The same way I think brushing my teeth and washing my hands is important, I think that these accessibility features are very important for our students. The last recommendation that I want to share is that they advise us to check in often with our learners. So at the time that I was putting this presentation together and thinking about this presentation, I checked in with my learners. So I want to share, this is a Google Jamboard where I ask students how things are going so far. And I know it's hard to read the small print, but you can look at some of the images. There are a few people who are a little overwhelmed, but by and large, the majority of comments talked about how organized things were, how they appreciated the level of detail, that they liked the checklist, that they knew what they needed to do and they got to it. When I asked them what could be improved, what's not working well, what should we change? By and large, most of the feedback was, could we make the modules available on Sunday instead of Monday? I got an email from a student, and it came at a time when I was very overwhelmed myself with the amount of preparation that I had to be doing for my classes that week, along with other responsibilities. And the student said, these times are very overwhelming, especially with classes kicking into full gear in this virtual learning setting. I really appreciate how you set up the modules in the class because it makes things so much easier and clearer to work through. And it makes me actually want to learn. And that has made all the effort that we put in worth it when we are hearing that our students are actually excited to learn. So at this point, I will stop sharing and we'll turn it over to Sue for questions and answers.
So one thing I wanted to note was on the questionnaire where you asked everyone's affiliation, by and large, the other are staff, a variety of staff. So I know for myself as an instructional designer, that's where I fall. And I think we have a variety of other staff folks from UMD and other institutions and organizations as well. So far, people feel free to enter your questions in the chat. So far, the only question we have is just thinking about what your future plans with this research are, and do you plan to expand it at all? And how are you going to share the results to a broader audience?
Oh, such a good question. What we do have planned is that we will do a little summative evaluation at the end of the semester. And I'm teaching 3 classes this semester. So what I've learned in this class, I'm already applying to my other classes as well. We have talked about putting together a campus course to share what we learned so that other faculty can also learn. There's so many great resources on campus, but we will think about how we can add to that. And we've talked about some papers, but we are not far along there yet. And I don't know if Bob or Roseanne want to add to that.
Sandy, I think you captured the essence of what we've talked about so far. Sandy and I are co-teaching a graduate course, and we have tried to incorporate everything that we've learned into that graduate course as well. And I'm going to be looking forward to the feedback that we get from the students in that class. And we got a little bit of a slow start this summer because we actually requested IRB approval for all of our data collection efforts. And one of the reasons we did that was so that we could actually do some publications and presentations and talk about the data that we've collected. So our intent is to share it broadly as best we can.
And actually, we were thrilled to be invited to participate this month to start sharing what we found.
I will tell you also that we've also been invited to do a presentation on this at an international symposium hosted by the University of Cologne in Germany that will encompass registrants from all over the globe who are involved with online course development and looking to see how to best reach out to the students in those courses. And that will be in early December.
I wanted to mention, and Sandy, maybe you can speak more to this, how we were discussing how it's quite difficult, especially as a professor, if you're teaching a lot of different classes, to incorporate some of these tools. And initially it might take much longer than what we have been used to doing, but really through this process, you see that the onus shouldn't be on the students to try and navigate the syllabus and try and navigate the online course. That if we can set that up as professors to make the student learning experience more accessible and more successful, then I think that's great. And just a side note from this, and I'm hoping that this study helps to push forward that there are a group of us working with CEF, the accreditation, to ask them to include accessibility in schools of public health as part of the accreditation process. So I'm hoping that studies like this will really help to move that forward as well.
Okay, so all of a sudden now we have loads of questions, and I'm not even sure if we'll get to them all. But let me try to see. There are a couple of themes in some of these. We had a couple of questions about the checklists, and if you could just talk briefly about that, how you distributed that, where it lived in Canvas, just to explain a little bit more about that.
So I include a checklist in each module, and I put it up at the top. I introduce the module. Here's what we're going to learn this week. Here's a checklist to keep yourself organized. And honestly, when this first came up in the interviews, I was thinking, God, why doesn't Canvas have something built in that students could just like check off that I did something? But since we didn't have that, I literally, it's a bulleted list in Word of the learning activities for the week. Watch this video, watch the next video, participate in this discussion board. And I'm really getting, it's come up in offhand things like when I've met with students, I really love the checklist. I print it out every week and it really, like, it's very satisfying. I know exactly what I need to do and I check it off and I'm good to go. So it's not anything complicated. Each week I pull up the old one, I resave it, and I put the new items in.
I will say that Canvas does provide a way
I feel
to
like
do that.
that little piece alone has been right.
I'm sorry, Sandy. I just wanted to add that Canvas does provide a way to do that in an ungraded quiz. You can create a checklist, actually. You could even use that as a prerequisite so that if someone doesn't check off that they've completed something, they will not get the next module released to them. But more importantly, they actually get a list of what they completed and what they did not complete. So there is a way to do it. But right now, the simplest way we found to do this is just simply to create a checklist at the beginning of the module so that people know what they're getting into.
And I have a message from Deb Maddock here to remind you that the Design Tools has a feature for a self-check as well, if you're a Design Tools user. I'm going to combine two questions here to try to get the two for the price of one. One question was, did you change assignments or change the way you did assignments at all? And how would you advise getting buy-in from faculty to make these kinds of changes in the design of your course?
Sorry, I already forgot your first part of the question when I started thinking about the second.
So did you have to change the assignments for the fall semester?
I did make some changes in the assignments. The more we dove into universal design for learning, recognizing that the importance of having options for demonstrating your work. So some things that I might have had as a written assignment, I am now realizing that that is not the only way that students could submit things, so that there's some options for you can submit it as a video or as a web page or as a presentation. So we have made some changes there. And now I forgot the second question.
How would you advise, so we have several instructional designers and other design support staff here. How would you recommend we try to get buy-in from faculty to do these kinds of changes?
I think that there's definitely an educational process, and I am not sure that I know all the answers to this one at all. But I feel like I've never gotten thank you notes from students before, and the one I shared was not the only one that I've received. The positive feedback is huge, and the changes are not that big. So going from what could be a frustrating online learning experience to something that's really positive is its own reward.
We have instituted biweekly brown bag seminars in the School of Public Health that are going to be focused on some of these things that we've learned, and hopefully if some of these things originate at the local level, it might get more buy-in, and rather than coming TLTC and Debmatics Group and a number of other groups on campus do a wonderful job at the campus level. But we're thinking that we also need something at the local level. And that's why we've instituted bi-weekly brown bags in order to address that.
Great. And we actually just had a question about, could this study be made available to high schools since they face the same challenges? So I'm sure if we can figure out the network, how to get this out, you would be happy for anybody to learn from this study, I would think.
Sure, absolutely.
And we are going to be, well, this has been recorded, and that's another part of the reason I think why we just had somebody ask about the recording, that more people who could not be here today for the live presentation will be able to view the recording and find out more about the study. There was one more question that I wanted to ask, and then I think Zachary wants to wrap some things up. So you focused on student disabilities, but we wondered if you had any thoughts on what students can do for faculty with disabilities. Did you consider that at all with this study, or do you have any thoughts on that?
We did not consider what students can do for faculties with disabilities. I think there is, there's certainly a power differential from faculty to students. The advice to check in often with our learners, I think, does help create a different kind of a relationship. And I think that I actually have been reading some online discussion groups from teachers, and there have been a few teachers who have shared that this is a national groups having personal health issues like breast cancer or other issues. And they talk about sharing those things with their students and how supportive their students have been of them. So I think there's a lot about the relationship. I actually got a question in the chat. I know we need to close in a minute, but talking about a professors trying to do these things, but having many demands on their time. And wouldn't it be nice if we had more support for some of these things? And I totally agree that some things would be really nice. I know it does take a long time to caption our videos and download the transcripts, and having more support to do that would be great.
I want to share, Susan, in response to the question that you just asked, in part because of my own health and some surgical challenges that I've had over the years. At one point, I spent 2 years in a wheelchair, and it was amazing because I couldn't walk as a result of a surgical error. And it's amazing how much I learned about some of the challenges people face because of any of these kinds of issues that we've raised today. Another time, when I was actively teaching, I couldn't lift my arms at all because of another surgical accident that happened. Yes, I've had lots of surgeries. And teaching without using your arms, without the thought of even being able to write your name on a whiteboard, raises some issues on accessibility of teaching methodologies to people with disabilities. So I think that's an incredibly important issue, but as Sandy said, we did not address it in this study. But we would like to make it accessible. We would like to make it available, everything that we've learned. Zachary, maybe it's time to turn to you.
Yes, thank you, Bob. I wanted to give a few thank yous here at the end. I wanted to thank Cheryl and Denise, our interpreters today. I wanted to thank Michelle for providing cart services today, and the University of Maryland President's Commission on Disability Issues for covering the cost of those today, and for organizing the events this month. So just a reminder about this being the second event this month, but there are many more, and hope to see you, some of you, at least at some of those other events. I know I plan to attend some more. I want to thank Alex, the GA for PCDI, for helping organize this, Sasha as well. There were many emails back and forth about coordinating this, so thank you for your help with that. And thank you for everyone attending today, and I hope you learned more about making courses accessible online.
And I'd like to thank also Mary and Louisa for their wonderful workshop this summer, from which we learned so much in the design sprints, and to others who have assisted us in any number of ways. Thank you all very much. Thank you for coming.
I think we can stop the recording now.